There is a new vaccine that is administered to moms to help protect their babies between birth and 6 months old from getting respiratory infections. But is there a hidden side effect of this vaccine that's not being talked about enough? Let's find out.
The FDA has approved the first vaccine for pregnant women to protect newborns against RSV.
The U.S. Food and Drug Administration is giving the go-ahead on the first vaccine to try to prevent respiratory syncytial virus in infants even before they're born.
Based on the data I've seen from this particular vaccine and its predecessor that was produced by a different company, I do have some concerns.
Abrysvo is a brand new vaccine that is indicated for active immunization of pregnant women between 32 and 36 weeks gestational age. It's intended to help prevent lower respiratory tract infection caused by respiratory syncytial virus in infants between birth to 6 months old. The Phase 3 clinical trial published in the New England Journal of Medicine was pivotal for the approval of this new vaccine. Overall, 3,682 women received the vaccine and 3,676 received placebo, and there were the majority of infants evaluated. What we looked at is, did the vaccine prevent severe lower respiratory infections in the infants? What we saw is that within 90 days, 6 infants of women in the vaccine group developed a severe lower respiratory tract infection versus 33 women in the placebo group. At 180 days, we saw 19 cases in vaccinated women and 62 in the unvaccinated. When we evaluate the effectiveness of medications, there is a concept called number needed to treat. The number needed to treat is the number of people that have to be exposed to the intervention, be it a drug or a vaccine, to prevent one adverse outcome. Number needed to treat is how many women would need to receive the vaccine in order to prevent one severe lower respiratory infection in an infant. When we look at the data from the Phase 3 clinical trial, we see that in the control group, there is 0.89% of people who had the adverse outcome versus 0.163% in the intervention group. When we do our calculation, how many women have to receive the vaccine in order to prevent one infection in an infant? What we see is that we have to give 137 doses of the vaccine in order to prevent one infection. Here's the issue. A British medical journal article has urged that we need further analysis of this vaccine because what is very cleverly hidden in the adverse effect profile is in the trial, preterm birth was described by Pfizer as an adverse event of special interest. I would say so. We're giving a vaccine to pregnant women and then increasing the risk of preterm birth. This brings up another concept in pharmacy called the number needed to harm. Remember, we have to administer 137 vaccines to prevent one infant from having a severe lower respiratory tract infection. In the Phase 3 clinical trial, as reported in the British Medical Journal, 5.6% of babies born to vaccinated mothers were born prematurely versus 4.7% in the placebo group. If we do the same calculation, we only have to administer 112 vaccines to cause one incidence of preterm birth. So the harm is more common than the benefit. And here's the worst news ever. The British Medical Journal also reported on Pfizer's phase 2 clinical study, where it had 2.6% of premature births in the placebo group and 5.3% in the vaccinated group. That means that you only have to administer 37 vaccines to have one adverse event. Even if we take the more conservative numbers, we have to treat 137 women to prevent one infection, but we only have to treat 112 women to give one child an early birth. In fact, in the clinical trials, severe maternal side effects included preeclampsia, gestational hypertension, premature rupture of membranes, preterm premature rupture of membranes, hypertension, maternal death, and fetal death. Also buried deep within the package insert is also the admission that Miller-Fisher syndrome, as well as Guillain-Barré syndrome, were also noted in the study populations. While the difference in preterm births in the Pfizer trials did not reach statistical significance, given the gravity of just how traumatic a preterm birth can be on an infant and their family, we need to take a closer look at when babies who have mothers who have been vaccinated are being born, and if they are born at a normal birth weight or if they're born underweight. This is also critically important because we know that GlaxoSmithKline also tried to make a maternal RSV vaccine and had to cease their clinical trials in progress because they saw safety signals that preterm birth was at an increased risk in the vaccine arm of the trial. It's important that we study vaccines thoroughly and ensure that they are both safe and effective, especially when it's the first vaccine ever indicated specifically for pregnant women. It's critically important that we dig deep into the safety of the new Pfizer vaccine, especially given that GlaxoSmithKline also tried to create a maternal RSV vaccine and cited safety concerns so valid that they had to stop their clinical trial in progress because they saw an increased risk of preterm birth in the vaccine arm. It is important that we have safe and effective vaccines on the market with transparency in data that can help parents to make informed decisions for themselves as well as for their children. It's also so important, given that this is the first vaccine that has ever been specifically indicated for pregnant women, we need to be more cautious. You can take the vaccine while pregnant. You can take the vaccine after the age of 60. But if we're going to use vaccines, let's be sure that they are safe and effective.